Well, hello, Courtney.
Hi,
How you doing?
pretty good. How about you?
Good. Okay, welcome everybody. I think we have folks coming into the room now. It's just a minute after 5. Courtney, how's it going? Are more people waiting or is everybody here?
I think that everyone's here, but I'll keep watching in case anyone else joins.
Okay, that's great. Well, hello everyone and welcome. It's really great that you're here. We were wondering how many folks would be able to attend this Thanksgiving week. I think people are kind of taking a breath this week in a lot of different places. So if I don't say it at the end, happy Thanksgiving a little bit in advance to you all. It's wonderful to be with you today for the STAR Project Stop Administrators clinic. We have a lot of words that describe who we are and what we do, but this is basically a clinic for all of the STOP administrators around the country. And we always are here to take some time. We've got an hour on our schedules to be able to go through any issues that you all are facing. And also to recently, we've had experts join us with a set of kind of an opportunity to really go deeper on some component or some aspect of your STOP administration. So welcome to you all. And it looks like we've got a really good group of people here today. So we always do an icebreaker. And last time with Olga, we actually linked the icebreaker to the topic and the expert that we're focusing on today. And so today we're delighted, and I want to just do a little introduction right now and introduce our speaker, Dr. Quenette Walton. And then I'm going to ask you the icebreaker. Does that sound good? I guess you can't see, you're muted. So I'm going to, that sounds good. Okay. All right, so first, let me thank Dr. Walton for joining us today. Thank you. Quenette Walton, LCSW and PhD, is a social work educator, research, and mental health and violence prevention consultant. She's had over 15 years of experience working with the nonprofit arena, addressing the intersection of race, class, gender, mental health, and more recently, violence prevention within diverse communities. In her work, Dr. Walton uses intersectionality, qualitative research methods, and science to address mental health inequities and violence to create social change. Dr. Walton also serves as a consultant to ALSO and is a licensed clinical social worker and an assistant professor at the University of Houston Graduate College of Social Work. So welcome, Dr. Walton. And I neglected to introduce myself. My name's Robin Hassler Thompson, and I'm also a consultant to ALSO. I've been so for a number of years now. My background is both as a STOP administrator and as someone, as a lawyer, and as someone who right now I've co-founded and I lead a local anti-human trafficking organization here in Tallahassee, Florida. So here's our proposed icebreaker question. For those of you who saw the introduction of this topic in your announcement that Courtney sent out, you saw that Dr. Walton was going to be joining us and that we're going to be talking about outreach to diverse communities, but also this issue of data, of qualitative data in particular, is where I think that we could start off speaking. And I know that when you start off writing your STOP plan, one of the things you think about is how are you going to tell the story of your jurisdiction, your state, or your territory? How are you going to capture what's going on? And often we go to uniform crime reports, we go to other sorts of things that come from law enforcement, we go to other kinds of data, population data, demographic data, census data, and that only goes so far. It's important, but it only goes so far in really telling the story, particularly of culturally specific communities as well as underserved populations. So I'd like to start our icebreaker right now and ask all of you to say if you have used qualitative research, and we'll talk a little bit more about exactly what that is, but in your planning process, have you used what you see as qualitative research in writing your plan? And so just if you could unmute yourself, and say your name and what state you're from and talk to us about your experience with qualitative research. And stop. Who would like to start? Okay, I'm going to call on people. And you know what? Does anybody want to start?
I could start with this. Oh, sorry.
Thanks. Go, Anne, I think.
Hi. Here, maybe I'll turn my video on. So, hi, my name is Anne Rausch, and I am the STOP administrator for Alaska, kind of the newer administrator. I haven't worked with qualitative data or analysis for the STOP program, but I also oversee our primary prevention programming in the state. So working with community-led, culturally relevant services that are really specific to communities. And a lot of our community work and evaluation within communities is process along with qualitative storytelling of what's happened in their community and how they're moving their work forward. This will be my first STOP plan. So, and we're going to be requesting an extension. This will be a wonderful opportunity to learn more about how it's being used, qualitative data collection with other states. So thank you.
Oh gosh, great. Thank you, Anne. And I appreciate that. And you have a really nice background. Before the next person goes, you can get ready and be unmuting yourself. I want to read from in the chat, Sarah Stevels from Indiana and the Indiana Criminal Justice Institute tells us she's new to her position and it'll be her first year. So her microphone's not working. And so thank you very much, Sarah, for introducing yourself there. All right, who else would like to talk?
Oh, this is Lana. Can you hear me?
Yes, thanks.
Oh,
hi, Lana.
I'm Lana. I'm from Kentucky, and I'm fairly new, so this will be my first STOP plan. I have no experience working with qualitative data or data analysis or any of that stuff. Fortunately, my director has run our state statistical analysis center, so I'm sure I'll get a lot of guidance from her. I think she may have taken the lead on that part the last time, so I suspect she'll probably do the same this time as she teaches me.
Okay, great, great. Anyone else? Bill? How about you, Bill?
Hi.
Hey.
Bill from New York. I'm the STOP and SASP administrator here. And as far as qualitative data, we tried to do it, at one point, there was really zero data being gathered in our state about sexual assault, or at least services for sexual assault. There was no comprehensive place to find the information. So we developed an interview instrument, and we had a series of 3 different interns working on it over a very long period of time. And it was the last one that actually got to the point where they were able to code some of the answers for us. But they were unable to complete the project before the semester was over. And so we have a bunch of half-baked data points. We have a lot of interviews that were conducted, but we have never tried to put it into anything because we didn't get anywhere where it was digestible. So we rely very heavily on just the regular numbers kind of data. And we tried to do the qualitative, but weren't very successful. We're not really researchers. So that didn't help.
Okay, great. Yeah. And then maybe we can also brainstorm how you can help some of your subgrantees, or even do a subgrantee project to collect some of that qualitative data. Anybody else? Anybody else want to just introduce yourself? If you don't feel like talking about data, that's cool too. Let's just say hi and see who's here. Laura, I see you're here. Good to see you again. Well, good to see your name.
This is Laura Russell from Oklahoma.
Hey.
We rely, like everybody else, on our domestic violence fatality review board data, our UCR data. We do surveys, and then we also do listening meetings or listening focus groups. Unfortunately, this year we haven't done any yet. They'll be remote. We like them in person, but we do those with the underserved communities, with our underserved and unserved communities. I did manage to get them in with our tribal communities through tribal roundtable meetings prior to COVID, but probably will try and reach out to those programs again, because I'm sure a lot of the information has changed since COVID. The last one was held, I think, the middle of March before everything shut down. But other than that, that's pretty much all we have done so far.
Okay, yeah, that's good. And Dr. Walton, I'm sure, is going to be able to talk to us a little bit about how we do all this work in COVID, in this time of pandemic. It's like a little different, right, Dr. Walton?
Absolutely, absolutely.
Very good. Thanks for bringing that up, Laura. Tanya, I see you joined, and we see your smiling face. You want to talk about qualitative data and research?
Sure. We did a survey that kind of collected some numbers data, but also some, anecdotal or qualitative information. It was really hard to sift through it. Actually, my colleague did a lot of that and kind of translated it into some graphs and fancy things for our implementation meetings that we've been having. And I'm not sure, I missed a little bit at the beginning, but I don't know if this is relevant, but for the first time in Pennsylvania, we've gotten access to like the raw data through our PFA system, which in Pennsylvania, it's called PFAD. I don't know if that's nationwide, I'm not sure. But so the state police have let us get that information. We have a data team also in Pennsylvania. So, our data team worked with them, the state police. We kind of had a hard time to getting that information. They didn't want to give it up for some reason. But we did get that information, and that's been really eye-opening for our implementation members. So I just wanted to mention that. I thought it was really good information, and we're not trying to like call anybody out. And so it's been a little bit sticky. Like, we don't be like, well, this county, you've been doing lousy, or, whatever. So we've been really careful with the data, but I think it's really helpful, and it's, it's a concrete number that people like to see too. Doesn't have a qualitative aspect, but it's been interesting. So
okay, well, that's really good. These little icebreaker sort of info sessions are ways that you all can see what's going on around the country and compare and contrast and learn from one another about what's happening. So this is really helpful, Tanya. Thank you. Anyone else like to weigh in? Just say hi. Michelle or Laura?
This is Laura Kwasny from South Dakota. This will be our first IP plan in South Dakota. We had a lot of turnover within our program. I think we're on our 4th director and within 3 years. And so it's going to be a lot of new finding our footing, I think, for us, and neither of us have done an implementation plan before, but we did just finish a formal needs assessment that we did, and we did try and collect some victim surveys directly from the company, I guess, that did our needs assessment, to kind of be that third party and not have the subrecipient or our programs asking the questions of survivors and victims, to try and really get an unbiased answer. And we really struggled to try and gather some of that information. And so we tried to go that route so we could use some of that to build our IP plan, but we weren't able to collect as much as we were really hoping to. Also, COVID kind of hit us right when we were trying to do that. And so, like everyone else, we had other things, people had other things they were worrying about. And so I think that was really, we struggled to get some of that feedback when we were planning. So it'll be interesting to hear what everyone else has to say.
Okay, good. And you brought up, how do you get the data directly from survivors, and which survivors, and how it comes, and making sure that that's done in a way that's sensitive and appropriate. It's a really good thing that you bring up. Anyone else? Michelle or Emily?
Yeah, can you hear me? This is Michelle.
Gotcha, yeah.
Okay, I wasn't for sure if my microphone would work. So I'm kind of in a unique situation. I've been with the grant for, 17 years, but this is going to be my first year actually helping and writing with the plan. So I haven't done a whole lot just yet. Tina Utley is also a program specialist, and so she'll be kind of working with me in regards to that. She's kind of done it more than I have, but we haven't really gotten going because I took over this position, and so it's kind of a combination position of everything. So hoping to learn.
Okay, great. Remind us all where you're from, Michelle.
Oh, I'm sorry. I'm from Missouri.
Missouri. Okay, great.
Yep.
Well, thanks. And we also got a note from Emily, who has a lot of background noise right now. So we're gonna not ask you to speak, I guess. You said you did a stakeholder engagement meeting, or several meetings, I'm sorry, and collected survey data from subgrantees and other community partners. We've heard from some of the participants that they enjoyed providing this feedback, would be open to providing more on a regular basis. And some of the stakeholder groups were more vocal than others. So by stakeholders too, I'm guessing you're talking about law enforcement, prosecution, as well as survivor support, victim assistance providers. So I think, except for anybody else want to chime in before we go to Dr. Walton? How about the folks from Also? Do you want to say a quick hi and let everyone know who you are?
Sure. Hi, I'm Mary Seifman. I work with Robin. I work with Quenette and Courtney and Marisol as well at the STAR Project of Also.
Okay.
Hi, I'm Courtney. I'm the program coordinator with the STAR Project at Also.
Great.
And I'm Marisol, the event manager at Also. I'm the one that helps support your travel to the STOP meeting when it was in person.
And sometimes maybe we be there again, right?
I hope so.
Yeah. Okay. All right. Great. Anyone else? All right. Well, Dr. Walton, you've got some fertile ground to plow, I suppose, having heard from everybody, but I know you're there already with this topic that you've worked in, sounds like a very long time. So what do you think about qualitative data, and what do you think about some of the issues that folks have raised here?
Yes, I was writing notes, so I didn't want you all to think I was being rude, just to get a grasp of your experience and how you've talked about qualitative data, right? And so it's more than just, answers to open-ended questions. And Bill talked about the stump that he came to, right? Particularly when it came to coding the data and figuring out what to do with it. And others shared like they've had some rich experience in doing it. I think it was Laura R. who talked about she's done some listening sessions, and other folks have talked with key stakeholders. And what was common, right, among all of your experiences, you can do so much, but then there's a stopping point, right? What else do you do? How can you go further with it? How can it really inform your implementation plan? And so I love qualitative data. That's my joy. I sleep, eat, breathe, think about it all the time. And so I like having these conversations to help agencies and folks get unstuck with how you do it and what it looks like and steps that you can take to be able to inform other parts of your work, right? And so when I think about qualitative data in particular, I think about it as a process, right? Thinking about the first step in identifying who do we want to talk to? Why do we want to talk to them? And why would they want to talk to us about the work that we do and that the services that they are not receiving? And how do we bring them into the fold of everything? Then I think about how do you design it, right? I know research for some and for OVW, I think may be a taboo word, but like in doing listening sessions, right? Talking to key stakeholders. So how do we reframe that to get people to come into the fold with us and to share their experiences? And experiences very broadly, right? And either seeking services, creating services, or doing services within their respective communities to be able to think about how can we better serve our population, right? And then I also think about it in terms of once you get all of that data, what do you do with it? How do you look at it? Where do you start? Who do you bring in to talk about it, right? And so there's different steps that can happen at each phase of the process. And then the other piece is how do you write it up, right? What is that write-up supposed to look like? And how do you dump it into, use those examples to report out, right? And then to do some testing back and forth with the communities that you collected the data from to say, this is what you share with us. This is what we gathered from you. And then did we capture it the right way, right? So that process, I think, not necessarily linear, but it's very fluid in how you go about it. So let me give you an example. I was the lead TA, lead consultant for the underserved TA assessment project through also. And it was a number of us, a very diverse group of experts who came together to really think about how do we gather the information we need from the LGBTQ as well as the Muslim and Orthodox Jewish populations. And we wanted to know how are they engaging in services and if they really were participating in services. And it took us a while to really formulate the questions that we want to ask, identify who we wanted to ask, and then where do we begin? And in that context, we narrowed it down to 3 states, but ended up extending it to 4 states. So we looked at New York, we looked at Texas, we looked at North Carolina, and in Chicago, where also it's based. What was surprising, most of our respondents came from Chicago, right? Not surprising, right? But very telling because that's where we had most of our consultants at, that's where we were planted. Some of us, myself, I'm in Texas, Houston specifically, and being somewhat new to Texas and Houston impacted, right? The connections that we were able to make with some of the people that we wanted to invite to participate in our listening sessions and key stakeholders interviews. We had folks in New York, but even though we had a good representation in New York, we still had very few people participating from that area. And North Carolina, it took several months to be able to make it happen and connecting with at least one agency to be able to partner with them to get folks to come to the listening sessions that we have and to participate in key stakeholder interviews, right? And so through that, we were meeting every week to really think about what are some of the roadblocks, right? How do we overcome them? Excuse me, who can we bring in that's situated in these specific states and these cities to really help us expand our reach? Unfortunately, and fortunately, I guess, the time that we needed to do the work wasn't the time that was available for the length of the grant, right? And so oftentimes when we think about the work that we do, we come up against the deadline for the money that's providing the services for for the project. And we ended up with listening sessions for more people in Chicago and that identified as LGBTQ than for our Orthodox Jewish and Muslim groups. Fortunately, I should say, with that data, some of the similarities that we were able to gather from the listening sessions that we did in North Carolina was very helpful in being able to think about like what were some of our pitfalls. And one, for example, is that our North Carolina contact had an also-chicago.org email address, right? And the address at the end of her email had Chicago, Illinois. And they specifically said, we didn't really respond to you initially because your email address was Chicago, things that we didn't think would impact it in the ways in that we were reaching out, but made perfect sense. So why would I want to connect with you in Chicago and we're here in North Carolina and you want to talk to us about how we're seeking services, right? So we had to foster that relationship, which I think is vitally important in the work that you do when you work with underserved or unserved or marginalized groups around this work. The other piece, we were not in the midst of COVID, right? And that adds another layer to the way in which we do the work and another way in which you have to engage organizations and community members to be able to do the work. And so through that, like we were able to plan and use what we've learned for our next step in the project, which I'm excited about, and thinking about how do we help our underserved grantees with engagement to be able to get participants into the work, to participate in the projects that they're doing. So we could talk a little bit more about that. Let's see. I think it was, who was it? Was it Emily talked about in the work that they did, some stakeholders were more vocal than others. And part of that was maybe due to the connection that they had with you. It may have been due to like, it was time, the time was right to be able to talk with you about what their concerns were. And you were listening. Oftentimes, when I do some of the research that I do, one of the questions I ask is, why did you participate in this, right? What made you want to lend your voice? And the number one response I get is because you asked. You were genuinely interested, right? And so if you show the interest, I think that's vitally important, and being able to get the responses and the data you need to be able to do the work you want to do. Now, does it take time? Absolutely. I was a part of a project that it took 13 years for the principal investigator to be, or the lead researcher to be able to build that relationship with community members, and specifically a community in South Los Angeles around issues related to mental health for an African-American community. It was building that relationship with the key stakeholder and / gatekeeper, I should say, to be able to allow them to do the work together. But over the years, they've been working for more than 20 years together to be able to address the needs of the community. And so I think with qualitative work, a lot of it is around relationship building. Who do you have at the table to help you build that relationship? Who in your network can help you inform the ways in which you respond, right, to those relationships? Who do you need to have, or who voices do you want to hear? And what does that mean when you hear their voices? Because it's one thing to hear, and it's one thing to center their voices when you're making grant calls for grants or requests for proposals to do the work, right? And then are you open, once you get some of the data, to think creatively about how do you help agencies build their capacity to continue to do the work and to continue to reapply? And I think a lot of the data that you can get, depending on the questions that you ask, can help with that, right? And so if there's any questions, let me stop there, because I know I probably said a lot, but let's see if there's any discussion or any questions that folks have about what I shared, or did it pique your interest in relation to the work that you're doing, or how to move forward with analyzing some of the data, even though you may not have the team to do it. There's some ways to think about it and some different approaches. So any questions?
I actually have a question. You kind of piqued my interest on something that I've never heard done before, which is finishing the research and then going back to the group and saying, did I get this right? Did we get this right? That sounds like a really smart thing to do. And I don't know how often it happens.
Yeah. oftentimes I think the most ethical way, right? We all are stretched for time, but the most ethical way to know that you're centering the voices that you have received and the data that you received and really listening to their voices is doing the check, right? It's like a check and balance. And if you can say, this is what we came up with, right? Does that make sense? And if not, what can we do to revise it so it can truly reflect what we've captured from you all? I think that is, for me, in the way I do my work, it's vitally important because things shift over time. You can capture those shifts. You can really think about the ways in which those shifts can inform the next step. It may not be something that you can do right now, but it can be something that you can do in the next phase of the process. And it's called member checking and qualitative work, right? You'll check it with your colleagues, like this is what we got, but really the people that you interviewed are the people you should be checking it with and for, because that's their voices, that's their experiences. And so being able to articulate that truly reflect what they want and need is vitally important.
You know, and that kind of goes to, Laura just chatted in here that they don't have a team to analyze the data. And what you said and what she's asking is also making me think about the domestic violence fatality review sessions that you all did recently and the importance of humility.
Yes.
So having a team that analyzes the data and then, you know, checking back, because you're not the expert on people and their lives, they are. And so having that humility, right? But can you talk a little bit about a team to do all of that and how you put those folks together?
Yes. So Robin introduced, I am a professor, and students in the Graduate College of Social Work have to do research, particularly the doctoral students have to do research internships for free, right? For free to you, but they have to pay in some context, right? There are schools of public health. Students are interested in gaining research experience. There are not only schools of departments of psychology, right? Utilizing students to help engage with the research process, I think is vitally important, or the listening session process, or however you want to plug them in, I think is vitally important. A number of students are really interested in gaining experiences at the state level, who folks are doing policy, making policy, working with organizations at a more macro level to see how they can create change, and you can capitalize on that. And so I say, if you have data sitting there that need to be analyzed, there are a number of folks that you can reach out to, or different schools that you can possibly reach out to and set it up as an internship, right? It may be someone within your department or within your agency that can serve as the primary contact and who can guide the students through the process, right? But they're bringing in some of their resources from the university, and they're using the resources that you have to really be able to help analyze the data. It's a huge commitment. And when you think about qualitative work, because the way the coding process works and how you set it up will be like weekly meetings in some ways to unpack everything that's being shared. And so I think creating a team of interns and internal experts and external experts, right, some of the key stakeholders that you interviewed, will be vitally important to help with that. In a creative and a low cost way as well. So thinking broadly and an impact, right? It's relationship building in some ways and stepping outside of what may be normal and how you dealt with the data, but doing something a little bit different to push, right, the relationship forward, to build capacity, to think about the ways in which you engage community members in the process. So.
Okay, great. And Laura, you're mentioning how your implementation planning committee sounds like you use them as a kind of focus group, if you will, before you submit it, and that you have a survey sent to funded programs and non-funded programs to make suggestions before the plan itself, before the plan is sent out. Is that what you're saying? Yeah, so you can work with this process in terms of the plan as a whole, not just this data element that goes in, and have that sort of review take place.
Yeah, we have our implementation planning committee, which has got some LGBTQ, African American, tribal, coalition members, law enforcement, prosecution. We've got all that on there. They review and make changes to the survey. they also review our implementation plan and make changes to it once we've made our draft. We also then send that to our focus group members as well, before we ever send it in, to make sure that the information they gave us that we put into the plan was what they gave us.
Yes.
So then, and then like all of our tribal programs, I've asked that, you know, would they be willing to have me send this to them and have them review it before we send it in?
Yes.
Some said yes, some said they didn't want to be bothered, you know, but those that did, I'll send it to them. Hopefully we'll get a lot of information back from them. So yeah, they all review all of that before we ever send that in. So yeah.
That's
So
fantastic.
technically we kind of have a review team, but
Yeah, that's fantastic, which I think is vitally important, right? There's a multiple checks and balances along the way. And ideally, right, I think every organization or every state wish they can probably do it that way. But, you know, I think that's a motto. And I hope you all are documenting how you do it, right? Because I think that can be shared with other administrators on how you did it. What were the steps you did to take to get to that point? What were some of the roadblocks, right? What were some of those lessons learned? I think that's a great way to do it, because then you get the feedback, right? In some ways, and you can document, this is how we did it for the next person who comes in after you all, to say, this is the model that we use. These are the pieces that we learned from. These are the pieces that I think you should avoid, right? Like just a documentation to be able to share what next steps can look like over the next couple years. That's perfect. That's exactly it.
And OVW makes you do some of that anyway. I mean, that you, for everybody who contribute, well, I don't know if you do it for everyone who contributes, but they do require you to go through your planning process and to detail how you got input from folks. And it sounds like you've got a really good one to highlight. And it also kind of goes back to something else you said, Dr. Walton, earlier about you get the best responses from people, or you got really good responses when they said you showed interest in them.
Yeah.
And I could imagine, as you all are writing your plans, if you share them with somebody and then they give you feedback and you incorporate that feedback into your plan, next year they're going to be a lot happier about often offering you some more, and maybe even pulling others into your process, right? So can you talk a little bit about that idea of showing interest, sincere interest in people's points of view, how that makes a difference, and how you do it? How do you show interest?
I wish there was a magic wand for that, right? Because I'm not sure, especially during this time, it's always challenging, right? But how do you show up authentically as yourself? Right? You ask the questions not about what's wrong with you, but help me understand, how do we get here? Right? The language that you use, I think, is vitally important, not terms of pathologizing individuals or communities or groups, but really thinking about like, what has been your experience? Right? What is it that I really want to know, and why do I want to know it, and what am I going to do with that? And being very clear and upfront about that, right? So this authenticity, this intentionality, and this investment, right? So I'm not only coming to you to collect information, but I'm going to do something with that to help create change, but I want this to be reciprocal, right? I think that's very important in showing interest. And then recognizing that showing interest takes time. It's like courting someone in some ways to be able to do the work, right? And we invite you into that space to work with us, but do not in any way, shape, or form violate that space, right? So there are some agreements that should be made in those terms. And I think the ways in which oftentimes we trip up on that is not being upfront about what we're going to do with the data and how long we're going to hold on to it as well. So I think that's important to be explicit about is in the work that you do. And then who else has access to it, right? You want me to talk to you about these experiences in my community that I've been dealing with for years to better a program that, right? So being very clear about who has access to it and what other folks will do with the data as well. So I think, and the interest, going back to that piece, really being honest, right? If you don't know, ask questions, but not in an aggressive manner, right? But really asking questions that can help inform the work that you want to do and the work that the communities or groups that you're interacting with want to do as well. So
Yeah. Because often I think with a lot of underserved populations that there's a sense of what are you taking from me?
That's it.
And if you're taking, for your own benefit, that's not cool, and how do how do you counter that and build that trust relationship?
Takes time. It takes a lot of time, and being okay with making those mistakes, learning from those mistakes, apologizing, right? Recognizing when you don't know or recognizing when you're overreaching, right? I always tell folks that I work with around the work, whether it comes to research or even with the students that I teach, you want to under promise, over deliver,
Mm.
right? And then that, like, oh, you did more than that. No, that's what I was going to do. And then I did more on top of that, right? So then folks can understand, like, they are really invested. And sometimes it means that we have to give up a little bit of something in our process to really even out the playing field, right? And really engage folks in a discussion that can be about authentic change, right? Whether the authenticity comes in the systematic approach, whether it comes in the grant making strategies, whether it comes in relationship building, right? Whether it comes a seat at the table, right? Like it's whether it comes in capacity building for some organizations who never thought about applying for funding, but will apply for funding through your help, right? So I think there's exchanges that have to happen, and it's like a dance, right? You take one step, I take one step. You take two steps, and maybe I'll take one, right? So really thinking about how you do the dance with different organizations and communities. So
Yeah, really good. Anybody got any questions for Dr. Walton? I actually just thought of something else, so I want to throw this out.
yeah,
And I'm thinking about the mutual arrest. So a lot of states have laws that are explicitly forbid mutual arrest in domestic violence cases. But even though states like I'm in Florida, I know that they still take place, right? And they don't follow the law in terms of doing that. So we've been talking about how these concepts apply, and we've mostly been thinking about underserved communities. But I just wanted to kind of raise that something like an underserved arrest, trying to go behind that data. If you can pull that data from UCR, the qualitative experience of talking to the officers who maybe have done that, the kinds of cases, the zip codes in your cities where it happened, maybe more than other places. So how do you go? So the question would be, how do you kind of go behind and realize that qualitative data is also relevant for these other sectors, so to speak, law enforcement, prosecution, and the courts and how they do their work, right?
I think part of it is like, how do you ask the questions, right? To be able to not necessarily go around, but go through, right? Because some folks are there as roadblocks, as gatekeepers, and want to maintain the status quo. And so maybe asking, now, why can't we do it? But help me understand, where did this blockage happen, or where did this shift happen, right? So how you ask the question can help move you through that challenging space, right? Instead of going around. I think going around can create more problems in that context. But I think asking questions that are out of curiosity, right, versus blame can lead to a lot more.
Absolutely. I mean,
a lot more information.
I would say, yeah, if you're starting to talk to somebody about a mutual arrest, it could really start off from a very blaming,
yes,
shaming place. And yeah, it's something to take into account. Any other questions about research or about this part of your plan? And I'm thinking too, we probably have all had both qualitative and quantitative data in our plans. Really have to. And they should be complementary as well, and feed directly into, and I know that Mary and I have talked about this a lot, is how the data that you all collect reflects the priorities and the needs that you develop in your plan and that you decide to fund in terms of programs. So those are all links to a chain that all come together.
And I also think when you link the data, or when the data is complementary, you can get a really nice approach, right? In terms of, approach maybe not be the right word, but you can get a nice view of what and how you can create what grant making strategies you can outline, the areas of growth for you, right? And we rely a lot on quantitative data for so many reasons, right? There's strength to that. There's a lot of benefits to quantitative data because it can be generalizable to a lot more populations over a longer period of time. But what the qualitative data does is give you this texture, right, that the numbers miss out on. And the texture in terms of helping explain how and what and why in different capacities, right? So what is it that led to this piece, right? Or how is it that this finding is different from that finding, right? And so the texture, right, can give you the depth and the ways in which you can shift practices and policies within your state. So then it can make it more accessible, right, for some of the organizations that you keep talking with or the communities that you keep talking to about being underserved, right? We can start shifting that so they can no longer be underserved and be at the table, and they're a part of the process from the next step of the work that you do. And so I think qualitative work is vitally important in what you do, as well as the quantitative, but for very different reasons.
A couple of folks in their intros were talking about, or in their responses to the icebreaker, we're talking about the challenges that have come up with COVID-19.
Yeah.
So please help us understand how we can do this work and do it extremely well. And all the answers you figured out how to make this just be able to do it.
It's patience, right? And I think your peers are going to be able to help you through it better than anyone else because they're in the thick of it with you. Some of the underserved grantees that I've been working with, what they relied on has been their network, other colleagues, right, to help move them through the pieces where they get stumped. And it takes a little bit longer, right? Given the trauma that folks are experiencing, given the crisis that we're operating in, given all the shifts that people are making, it's taken longer for folks to respond to email, to pick up a phone, to return a call, right? And so I think we have to be a lot more patient and a lot more flexible in how people show up and what they can share and what they can give. So instead of having a 4-hour meeting, maybe it's an hour and a half, right? Over a course of 2 days or something of that sort. So really rethinking how do we engage with each other, right? And engage with other organizations to do the work. I think COVID-19 has pushed the limit, right? And pushed our creativity, the limit in terms of where we are physically, emotionally, and spiritually, right? Because we're feeling taxed. But I also think COVID has pushed us to be a lot more creative in how we do our work. We've had technology before, but now which technology is best? Which one is most approved and accepted from our organizations and even OVW that will allow us to do the work that we want to do? And so I think part of that is in how you're more creative this time around and who you rely on to be able to help work through some of those challenges.
Yeah, shout out to also for the last series that you all did on domestic violence homicides, and how in these Zoom meetings you had present American Sign Language interpreters. You had the ability to have closed captioning. You had language translation available. So, just when you think about COVID and doing the outreach that you all want to do, and since, we've got some time with you're working on your plan, and Dr. Walton mentioned you have to really have a long view with some of this stuff, but really checking into how you can have your Zoom meetings and have these accommodations just be like falling off a log. Just assume you're going to have them, figure out how much they cost, get them set up so you can have the meetings and not get caught up short if someone at the last minute says, I need this, and you don't have it ready. So how do you do all that? So we talked about this a little bit in one of these calls earlier. Anybody have experience with that, with doing sort of any other ideas you have about how you accommodate doing qualitative research and gathering qualitative data during COVID? Anybody figure it out yet, how to do it well and easily? at the beginning, people were saying, oh, it's better because people don't have to get in their cars and drive. They don't have to, worry about childcare because their kids at home. Well, that goes both ways.
Yeah.
But there was more participation. Are we still seeing that? Are we seeing it dropping off?
Yeah. Emily said, I think it is helpful.
Definitely dropping off.
Mhm.
Yeah. Is it dropping off now more towards the end of the year because it's the timing of the year, or did it drop off the more people got tired with Zoom, right? Or any other meeting?
I think it dropped off about mid-year.
Yeah.
I mean, not just recently, but I mean, I know our first couple of meetings, we had great participation, and the last two, So I'm hoping maybe after the holidays, our next meeting is March. So I'm hoping we can really get back to maybe they'll want to participate again.
Yeah.
But I think it's just the total number of Zoom and remote meetings everybody has. I think they're just absolutely sick to death of them.
Yes, they are. At first, it was like really exciting, right? To be able to connect with folks across state lines and not having to drive because there was the convenience around that. But then the other piece is that when you're on Zoom for an extended amount of time, you get Zoom fatigue, you get headaches, right? You become a little bit more achy, you forget to take care of yourself, you don't walk around, right? And so all of that is coming into play, and people, I think, are just done very, very much so. And really thinking about not necessarily self-care, but wellness, right? How do we shift to become better in the ways in which we do our work, right? And then are we setting up our spaces, whether we're working at home or in our office, so that it can accommodate time away from the computer to do other things, right? And we don't think about that. And so I think it's very important as we reconnect after the new year and the way in which we do our work. What does it mean to be on Zoom during this time? How long are our meetings? Who does everyone have to attend? Do cameras have to be on? It's like all these other questions that have to come into play to be able to address it. So
Yeah, just noting in the chat, Emily's noting that shorter meetings really good, and also having the opportunity to have writing opportunities. If people want to respond and write and be thoughtful about answering questions, those are excellent ideas. And Emily also notes, I block out extra time and then try to end early, which we can do now, even on this one. The other thing that strikes me, Laura, that could be really good for you to do now, knowing that you have this coming out in March, is sending out a quick note to people and saying, look, maybe we're going through some Zoom fatigue. Maybe what are the best ways? What would accommodate the particular populations you're about to reach out to, and say, we did it this way back in July when it was kind of okay, and everybody was, would that work? Do you want to do something else? Do you want to it could be short surveys online coupled with other things. Mary notes that some of the colleagues start earlier and end earlier, and make sure to take lunch, spending time with their kids who are doing remote learning at home. Really asking people how it will help them to take care, to be more present. We used to always say that at the beginning of meetings, what are our meeting ground rules? And one was being present. And maybe a little survey, open-ended question at the end. What'll help you to be present during this 45 minutes we're going to ask of you, to just make sure you can be focused on us and what our work is together. What'll help? And then listen to what they say, like a mini qualitative thing, right? And give them that feedback.
Yeah. And then it's solution, focused, right? Like, we understand and acknowledge everything that's been challenging, but let's figure out something that's doable, right? Where we can all be successful, which I think is vitally important now more than ever. And I'm thinking, I have a 2-year-old here at home, and she comes to my computer now and shuts it when she's done with me being on Zoom. So, right? Like, when you think about you're at that point, what is it that you need, right? And is it a reminder, setting timers, so then that way, we can make sure you get a break. If it's 15 minutes, we talk and check in, and then make sure everyone has their snack or whatever the case may be to be in the meetings. How can we support one another? Because I think now we're shifting from this very individualistic approach to doing our work to more of collectivism, right? What does that look like? How do we connect with one another to make sure that we're getting the work done and doing it to the best of our abilities? So
I just put a quote from you in the chat because I love it. What's doable so we can all be successful? Isn't that the best? I mean, that's really a great way to embrace it. So, so thank you. Thank you. That makes a lot of sense. Anybody else have any questions before we wrap up here? Any questions about qualitative or quantitative or anything else that you've got on your minds in terms of your STOP planning process? All quiet. I think people want to leave early.
Yeah.
Okay, let's do so thank you everybody first of all. Thank you Dr. Walton for your expertise and your time today. And I'd like to ask Mary to do a commercial for the next one of these, kind of a promo that we're going to be doing on December 7th. So Mary, why don't you take it away, and I'll just say thank you to everybody and let you all close.
Thank you, everyone. Thank
Yeah,
you.
awesome. Thank you, Dr. Walton. Thanks, Robin. So on December 7th, we're going to do an Ask Anything Stop TA Clinic, and Marnie Shields, OVW attorney advisor, who knows everything there is to know about STOP, the statutes, the regulations, everything that's allowable and not allowable. She will be joining us during the clinic, and so you can queue up your questions and have those ready for her when she's on. And then if you have questions for us at the STAR Project also, we'd be happy to answer those as well, and including stuff about doing remote meetings, so virtual learning, accessibility options, those kinds of things that Robin was talking about as well. So we're happy to help with that, or doing Zoom. We've been learning about Zoom features and interactives, and so things like that. So even just thinking beyond STOP and implementation planning to how you might engage in some of that qualitative research with the folks in your state too. So that should be a fun one. It's always good to have Marnie around to answer questions. So I think that's it for today. Have a happy Thanksgiving and a safe one to everyone. And thanks for joining, and thanks for facilitating, Robin. And thanks again, Dr. Walton, for all that great info. We're holding our next workshop, by the way, in that series on Monday, the 30th. And then we have our follow-up and very final last part of that series on Wednesday, the 2nd of December, for the final discussion with all of our great faculty. Hope to see you then. Thank you, everybody.
Thank you. Take care, everyone.
Bye. Thanks a lot.
Bye, everyone.